And so I wanted to cover today not only what we're seeing across the United States, but some of the testing data to assure from the prior question, if we're testing, I'm sure you're following our numbers every day, and the amount we're going up, about 118,000 to 120,000 per day are being tested. So we're way over the 750,000 per week currently. We have some statistics. Now remember, we required this, thanks to Congress, to be reported. We have about 75% of that test data in now. About 1.5 million of those tests have been reported in. I just wanted to give you some ideas because sometimes we think that we're only testing in the hospitals, that this should give you an idea of the quantity and the types of tests that have occurred. So we've tested over 200,000 young people up to age 25. They have about 11% positivity rate. Over 500,000 people between 25 and 45. They have a 17% positive rate. Now remember, in order to get tested, you have to have symptoms. So this gives you an idea of the number of people who have symptoms that are not infected with coronavirus. Another nearly 500,000 people between 45 and 65, their positivity rate is 21%. Another nearly 200,000 between 65 and 85, 22% positive, and a small group of about 30,000+ individuals over 85, and they have a 24% positivity rate. And so this gives you an idea of we're testing throughout all age categories. I see a lot of men in the audience today. I just want to remind them about the importance of health care. Of the male-female ratio, 56% of the people who are tested are female, 16% positive, 44% male, 23% positive. So again, it gives you an idea about how men often don't present in the healthcare delivery system until they have greater symptomatology. This is to all of our men out there, no matter what age group. If you have symptoms, you should be tested and make sure that you are tested. We appreciate you engaging in that, and also really recognizing the issues about comorbidities and making sure that we're addressing those. I had a series of great calls with about 17 states that are in our more rural areas, specifically around our indigenous people and tribal nations. It was a very reassuring call, and we are testing across the country. We do have about 63% of states that have less than 10% positive despite significant testing. And within the indigenous peoples and tribal nations, they're seeing the same thing that we're seeing across the nation. Increased issues among those with comorbidities and those of elderly, but also issues in nursing homes. And so they are testing, many of these states are still capable of doing full contact tracing. And so they've been doing contact tracing from nursing home outbreaks and other outbreaks. It really gives us a clear impression of no matter what we do in the future, we need to really ensure that nursing homes have sentinel surveillance. And what do I mean by that? That we're actively testing in nursing homes, both the residents and the workers at all times. That is where, and that's how we saw this at the beginning. That's what we saw in Washington State. And that's what we're seeing in many of the states that have very low case attack rates. The other thing that I want to leave you with, we certainly know how desperate and difficult the situation has been in New York over the last few weeks. And we've been telling and talking about how this would be the week that would be most difficult because of the large proportion of cases that are coming from the New York metro area. What's been encouraging to us, those early states outside of Washington and California, which still have extraordinarily low attack rates because of their level of mitigation, all of the new areas that are having new increasing cases, we talked about them yesterday, Washington and Baltimore and the Philadelphia metro area. That includes Camden, Wilmington, and the counties around Philadelphia. We're seeing that the case numbers, what we'll get to as far as attack rates, we talked about 1 and 7 in 1,000 in New York that are being measured. These are coming in, even with their progress up their curve, in the 1 to 2 per 1,000 range, showing that when you start mitigation early, it has a very different impact. All of this data is coming together, the testing rates, the seropositivity, the age groups, who really needs hospitalization, ICU, the innovative pieces coming from, we heard a great report from Louisiana this morning on the phone call where they talked about a minimum now of 40% of people coming off of ventilators alive and leaving the hospital. This is very encouraging to us. Really shows amazing progress clinically at each of these hospitals, and the real lessons what we're learning and sharing across hospitals. But really shows us that the original outbreaks were very large, but the newer ones that we talk about in Washington and Philadelphia and Baltimore, it looks like their attack rates and the attack rates in Denver and some of these other states that we have been talking about are much lower than New York and New Jersey. And this gives us hope about really understanding how to integrate this information together, not dealing with a model, but the real life cases that are occurring and understanding how to move forward together to really have a different future. So thank you very much.